HIV patient, ma'am, a woman, she's not willing to disclose the fact to her husband. This we have to we have to break the confidentiality, ma'am. This also, yeah, I wanted to tell you.
So that is
safety,
tricky. Okay.
Safety of the husband, ma'am.
Sorry?
For the safety of the partner, ma'am.
Okay. So I will say, try to steer a bit clear of very, very explicit warnings to the patient always. Okay. Always. You always remember that our priority, as per even UK law, like as per UK practice, our priority is our patient sitting right in front of us. There are a huge number of articles on this. Yes, we understand patient safety for her husband and all that, and for potentially any of our sexual partners. But if you Google articles about that, there are numerous articles where you actually can be in a dilemma. There is no clear black and white thing on that, okay? There is no clear black and white. You have to always say, we'll encourage you to share this with your partner. If you need our help, we are happy to provide that. At the moment, although your health is my top priority, and I will need to do this for you. You mentioning this much is enough. You don't drag her to the court, okay? Please try to avoid that. That, oh, I've caught her red-handed. She hasn't informed her. You're not there to scare her, okay? And don't try to warn the patient. That's absolutely unacceptable. Absolutely unacceptable. You cannot try to be a hero there, okay? Don't do that. So anybody who is trying to say this to the patient that, no, I'm sorry, I have this legal responsibility, I have to inform your husband. No, that's not. I will absolutely request you to avoid saying these kind of sentences there. Say, will encourage, because they're not going to deduct your marks, okay? You say, I encourage you to inform your partner for the sake of his health as well as for your health, because if he doesn't get it, and you get treated, you both can benefit from this, okay? So you are saying that I'll encourage you, and you're saying that if you wanted to, if you wanted our support for that, we have people here who will support you. We have trained midwives who can arrange a consultation with you and your partner. And what else can you say here? You can say, it's okay, you don't have to decide it right now. Just think on this and we can always talk about it later. So you please don't try to drag her into that corner in your exam, because that's a very poor communication with the patient if you did that, okay? If you try to say, no, this is my legal responsibility, how the hell we have to inform your partner, you will infect him. If you try to show that kind of attitude, that's a very poor communication with the patient, okay? That's almost a failure, okay? Why is it? It's not only poor communication with the patient, she will be terrified and she will not want to come to the hospital. It will become a patient safety issue, okay? You see that? Am I clear on this one? Hello.
You are clear, ma'am. You are clear.
Okay, good. So I have to check, because this is a new a place where I have moved to, and I'm not sure how well my signals will work here, because I know that the EE coverage is not very 5G here, okay? So please do let me know when there's a problem with the voice, okay? Okay, so let's move on to any other example somebody wants to clarify. Like the HIV example is extremely good example. Thank you, Manika. I really appreciate for you, for bringing this up. Any other example somebody wants to clarify, please?
Hi, Dr. Sam.
Hi, Salma.
Hi, can I ask you one question?
Okay, if it's relevant, of course.
Yeah, like I just married a male patient, if he will come. So at the time for breaking bad news, do you think that we can tell that is somebody with you, or I'll maintain the confidentiality not to tell that somebody with you while I'm
Okay.
breaking
Okay. So it depends, the breaking bad news. Is it like cancer, or is it like HIV? And if you are asking that, would you like somebody, your partner to be here, then you're not breaking confidentiality, because you are not forcing her to bring somebody in. You're just offering her that this, I will need to give you lots of information, and you might find it difficult. Do you want your partner to be present with you? So where is the breaking of confidentiality? I don't understand, because you're not forcing, you're just
No.
offering.
This is azoospermia, male patient.
In male patient, again, you're offering him. And azoospermia is not really a breaking bad news. Who told you that it's a breaking bad news?
Yeah, whatever it is breaking bad news. They told that. So is it, I should tell that for azoospermia, that if I'll explain to him, should I tell that is somebody with you, or no need?
No, this is not a somebody with you station. Azoospermia is not somebody with you station. Okay, it's
No
not
need,
like
no need.
that kind
Okay.
of.
Ma'am, it has
Okay.
to be kept confidential, no, ma'am?
Yeah, you will, if he wants to, talk with his partner as well, offer him that if you want to discuss this. Suppose this is a male patient who's come here and he's got azoospermia, and you say that, I'm sorry, I don't have a good news for you. Now, at this point with azoospermia, you're not going to ask her, do you have, he's not dying. That somebody with you is only for people who are dying, okay? Like who've got cancer. Then you say you got somebody with you. He's not dying. So please, you have to remember the difference of, some news that's not very good from, you need to differentiate it from a breaking bad news. Breaking bad news is like a news of impending death, okay?
Yes, thank you.
Yeah. So
Yeah.
here you'll offer him that I have
got
this, I don't have a good news really. So are you okay for me to discuss about that? If it was a bit serious, then I'll say you want somebody to be present, like my nurse to be present, but I won't offer him even a nurse. Okay.
Thank you very much.
I'll say that this is the case. Yeah. If he gets upset that we were trying for the baby, I'm so upset, and if he starts becoming, very emotional about that, then you can say, do you want us to discuss this with you and your partner together? Do you think you find it difficult to discuss with her? Because he may find it difficult to discuss. Then you can offer. If he's becoming emotional, then you can say that, would you want us to help you with, discussing?
Then finish this one. So if patient is for any reason, she's taking steroid like prednisolone more than
He's
2
taking what,
weeks,
sorry?
prednisolone for if she's taking prednisolone more than 2 weeks and she's taking 7.5 milligram, okay, and more than 2 weeks. So we usually advise the patient during labor, we'll start that injection hydrocortisone, yeah, to will give her stress doses. So how will present the patient this kind of things? Do you think that how will in lay language?
First of all, you need to remember that this is not a structured why you're talking about. Okay, you're talking about this communication with the patient. So please, this again will be a very poor communication if you started teaching the patient all the medicine. Okay, so this is not good. This is information overload, and all you need to say is that depending on how much steroid you've been taking and all that, and your dose, and especially nearer to the time of delivery, your MDT, you don't keep everything. You're not one-man army. You don't keep saying, we will do this, we will do this. Say that your MDT may decide to give you, some injectable steroids, but that will be at the time of, that will be the decision made by the MDT and closer to the time of delivery. Okay. So don't try to be precise about, just say some injections. Just if you want to say injectable steroids, you can say that, but you say may need, you may need, okay? Then you're safe. If you say
why
may need.
do you think that why I'm changing this medication to injection like stress dose? This is stress dose, how I can present the patient that to, I have
No,
to
you don't need to. No, please, you don't need to.
Okay.
No, I will not say this thing to the patient.
Okay, thank you very much.
That's very, very unacceptable kind of information overload for the patient. If she asks, you can say. If she doesn't ask herself, no need to say that. Okay.
So
You're
if
not teaching her this becomes, adrenal insufficiency, you'll end up with this, we'll, give you external steroids to cope with that. You're not going to say that. This is very poor communication if you try to do that. Okay.
Yeah, if she asks, then how I can explain that,
She will not ask you. Then you choose your own words. I will not go down that road. Okay.
Okay, thank you very much.
Okay.
Thank you for your
Okay.
explanation.
So otherwise, girls, if you keep thinking on this direction, you will be really stuck. Why I say this, what I say, and why I am so explicit and on this matter, why I discourage you so much on this matter, because one of our lovely friends, she started telling the patients about M rules and B rules. Okay. So that was scary for me, because that's such a poor communication that why would you want to tell patient about M rules and B rules if the patient has ovarian cyst? If any one of you thinks that this is what you should be doing, then please think again. Delay your exam if you think like that. Okay. So you have to be very, very careful talking to the patient and telling them these things is actually trying to talk to the examiner through the patient, and that's a very rude attitude. The patients don't like it. The role players strictly don't like it. If some information is not meant for a real patient and it's meant for you to try to impress the examiner who's sitting there and marking you, then you are cheating, you are tricking the patient, and patient feels insulted. Okay. Anyone has a doubt on what I've said, please raise that with me now. Okay. So if you try to explain the science behind so many things, that will be that you are trying to explain your scientific understanding when even the patient doesn't require that kind of patient overload, unless she asked, okay, unless she says she wants to understand something, that's a separate issue. A very basic understanding, yes, you should provide very basic, okay. If you try to overload with a mechanism of action and all the science behind these kind of things, that will be talking to the examiner through the patient, and the role players don't like it. They really find it absurd that you are tricking them, okay? So please, girls, don't do that. Okay, this is again one thing that was being taught in so many groups, and although to be honest, I don't want to sound negative, I really admire all those groups who are teaching the candidates and doing a lot of good job as well. Okay, but somehow it's not easy to be sitting overseas and trying to understand all that happens here, thinking that we explain these kind of things to the patient is just to some extent, very, very basic extent, okay? And if the patient is wanting to know, we can, add this thing. I've never encountered a patient who would want to know about the steroids, okay? So trying to understand what the patient anticipates from us. It's not easy sitting abroad, sitting overseas, and trying to let the candidates know. So it must be a difficult job for those mentors to guide on these aspects. But the only disappointment is when they guide with such a confidence when they don't even know the things themselves. Okay, guiding with such an overconfidence means that you guys are all kind of misguided really, and that was the reason that our friend said talked about M rules and B rules with the patient, and then she cried. That poor girl, she cried. It really broke my heart. She cried that why I failed. So please be very judicious about what you're saying. Okay, all that you know in the exam, you should avoid the desire to vomit that out in the station. Yeah, avoid the desire. You see the station and you say, oh, I know this topic very well. Doesn't mean that now you start giving this headache to the patient. Okay, clear? So who do we have here? What aspects I think are mishandled badly in the exam? Yeah. I personally feel that when I hear you guys doing all the station rehearsals, I feel that you don't handle, yeah, yes, no worries. By chance, this chat box is open in front of me. Otherwise, I'm never able to see the chat messages. Okay, so what I think is mishandled usually is how you handle with an obese patient, with a very high BMI patient. You guys, I have a disappointment. I can say that I've not really heard anyone saying the best words to a high BMI patient. You are either, no, I wouldn't say you are, I've never actually seen any harsh comment. You guys are very, very careful about not giving any harsh comment to an obese patient, but and we don't use the word obese, of course, we're talking here class with the patient, we use the word of high BMI, not obese. Okay, so but what do you don't go to the harsh side where you're too softy, so you'd say your BMI is a bit high. So it's not a bit high. That can become a patient safety issue. If you tell a BMI of 40 that your BMI is a bit high, slightly high, that's absolutely not correct. But this kind of things require, kind of intensive training, how to deal with the high BMI kind of questions and but you need to focus on this. Please don't say to the patients that your BMI is slightly high. Okay, then you come to the cancer patients. So there are questions about cancer patients that you people don't understand how to handle various difficult questions by the patient. So you need to rehearse now, you need to jot down the important aspects that you find difficult. You need to practice them, okay? Write down your pet sentences and practice them. I will want to answer one question from that I received in my inbox from actually 2 people. That is this exam something that I need to do with a partner? Does anyone else have this kind of question in their mind, that do you need a partner to practice this exam? Anyone has this question? Okay, so Asma is saying yes, yeah. Okay, so Asma, no, I'll just mute my, for a second, just mute my. Sorry for the distraction. So, yeah, so girls, I was sent this message from a lovely girl who said that she has a study partner who was almost a bully. Like she was actually crying that my study partner is like a bully, and I'm so stressed and I think I'll fail this exam. What should I do? How can I prepare? I'm not able to find any partner. So for anyone else as well, I need to I need to highlight that please remember that not everyone would need a study partner for even practicing this, okay? We can do a separate session if people are interested to find out how you can do this preparation without a study partner, okay? But it's absolutely possible, because you don't need a speaking practice actually for this exam. The speaking practice that you need can come in front of a mirror as well, okay? All you need is that whenever there's a station in front of you, you need to ask yourself that what are the questions that somebody can ask in the exam? What are the questions that a role player might ask me in the exam about this topic? And then you need to know the answers to those questions, really. People who try to, who try to kind of stuff everything in those 10 minutes in that practice, I know that's a common practice, but that's not really required. It's an extensive discussion on this, why not? But I can give you a hint that you may practice answering some other aspects in those 10 minutes, and the role player may actually have totally different questions. Okay, I'm not a fan of the templates and all that, because the templates actually cause people to fail. If I was able to find more time for you guys, I'll make separate videos on these topics individually. I don't find time for these kind of things, but these do need a lot of detailed kind of looking into that, why is it that you want to follow a template while the role player may have some other questions for you? Please just remember this thing in your mind. So the 10-minute thing doesn't matter to me. If somebody finishes something in 12 minutes or 14 minutes, I don't mind, because why would I worry if somebody, is finishing in 12 minutes? Because the role player will give you certain amount of questions and you will have to answer those questions. Okay. So please, 10-minute. So it's not important to have a study partner. You just need to have a board in front of you or a page in front of you. You write the condition there. You say, okay, what are the potential questions that can be asked and what are going to be my answers? This is all that you need to know for the exam. So for me, to be very strict, you may think that I sound like an idealist kind of person who, impractical, not pragmatic, but I tell you that this is the most pragmatic approach, that you only need the answers to all possible questions, full stop. Okay, you don't need a 10-minute practice and you don't need any template. These templates especially can help you to fail the exam. Okay, they don't help you pass the exam. So sorry, I'm going against the tide here, because the common version is templates and all that. Okay, so what else do I think you do? Okay, guys, I want you to read governance, audit, and these kind of things a lot. And I think you guys struggle with the labor ward and gynae prioritization as well. Okay, now if you have any question on that, you can ask me now. I'm happy to answer.
Yes.
Okay.
Yeah. Dr. Sam, they are telling that before labor ward prioritization, just to explain that about the patient comorbidities, I have to know allergy, and before explaining the all case, to mention that if patient need antibiotic, I'll give, or which patient require the blood transfusion, I'll check Jehovah's Witness, patient allergy, everything to mention before the case presentation. So what do you think? And also the gynae list prioritization also, that I'll check the WC checklist, and also that patient allergy, comorbidities, she has any operation before or not, and BT prophylaxis if needed. So can
you complete the stations with that? Do you think you can ask everything and you can still finish labor ward prioritization and gynae theater as well?
No, for me, I don't follow this one, especially the labor ward. It is too difficult to explain this and then to cover. But gynae list may be possible, but gynae list, if not all patients require this, because that's why they mentioned that we have to tell that which patient need VT risk assessment. So before that, we'll check this and comorbidities. And previous,
and there's nothing that you can generalize in. And if you started asking labor ward, in labor ward scenario, if you started asking for every patient, you will just not be able to do the answer them the important aspects that they want to know. Okay, so you waste all your time. That's not on the checklist, and you will be wasting all your time. In the gynae list, again, whatever is relevant, you need to do that. You're not like a kindergarten kid who will just have a list and you will keep saying it for everyone. You don't need that, and that's not what they're seeking there. Okay.
Thank you very much.
Any other question on labor ward and gynae theater? And girls, please remind me to share with you the topics of clinical governance that I want you to go through, and you guys should know them. Okay, I'll try to do a separate video on them, okay, as well. So just to facilitate that, what kind of questions to expect and how to handle. If you remind